This is a story about H. pylori.
It's a bad bacteria.
It destroys your guts. So listen up real close,
And we'll give you a real good dose of information about
H. pylori.
Heliobacter pylori.
Ooh.
Thanks for coming to our presentation about Heliobacter pylori, and especially you, Dr. Mandyam, and anybody else who wants to watch this. So, we're going to tell you about a really special bacteria today that some of you may have come into contact with before, and it's called Heliobacter pylori. So, the first thing we're going to talk about is cause and contagion. So the causative agent of H. pylori is actually unknown, but it can be passed through direct contact with saliva, vomit, or fecal matter. Also, it can be spread through contaminated food and water. So it is an oral to oral or oral to fecal transmission, and it lives inside and infects the stomach and the GI tract.
Some risk factors of getting H. pylori are living in crowded conditions or living in a home with a lot of people, living without reliable source of clean water, living in developing countries or crowded and unsanitary living conditions, and also living with someone who has H. pylori.
So what does H. pylori do? It actually produces the enzyme urease so that it can survive in the stomach, which is very acidic. It is really contagious. It inhabits the mucus layer of the human stomach, and it causes gastritis, peptic ulcers, and can also be a risk factor for stomach cancer, although some people are completely asymptomatic. So next is going to be statistics and symptoms.
So the epidemiology and statistics, it usually affects children, and it affects at least half of the US population, and more than 60% of people worldwide are affected.
Definitely. So what are the symptoms? Some symptoms of H. pylori include an ache or a burning pain in the abdomen. The abdominal pain will get worse when the stomach is empty, nausea, loss of appetite, frequent burping, also bloating, and unintentional weight loss. So next is immunology.
So basis for symptoms: helical shape and flagella, boost movement through viscous mucus, lipopolysaccharides, endotoxins found in the outer membrane of gram-negative bacteria that stimulate the release of IL-8 and other cytokines and leads to acute inflammation. VACA and CAGA cytotoxins are virulence factors that are polymorphic and affect a multitude of host cellular pathways. Urease and pH neutralize gastric acid.
And let's talk about the immune response. So when someone gets Heliobacter pylori, it triggers innate and adaptive immunity responses. So it does trigger phagocytic cells such as T cells, neutrophils, and macrophages. Also inflammatory chemicals such as interleukin 8 and other inflammatory cytokines.
How does it get away? Heliobacter pylori, it avoids cell death by phagocytosis. It promotes apoptosis of APCs and gastric epithelial cells, uses molecular memory, manipulates regulatory and helper T cells, and interferes with antigen presentation.
Yes, very smart bacteria. All right, so next we're going to talk about prevention and treatment. So as far as prevention goes, make sure that you always wash your hands, eat properly washed and prepared foods, make sure that you're drinking from a clean water source, and manage your stress and improve your diet, which will therefore improve your immunity and allow the body to heal. And also provide resources to underdeveloped countries. And all of these are suggestions by the CDC.
So Western medicine treatment, usually quite often they use antibiotics to kill the bacteria, such as amoxicillin, proton pump inhibitors such as Prilosec, histamine blockers such as Zantac, and bismuth subsalicylate, which are usually used in combination with the above methods that we mentioned.
All right, so as far as progression and prognosis, the prognosis of Heliobacter pylori is good, but the ulcers that are caused by it can lead to hypertension, bleeding, and anemia, and 20% of people who are affected can easily develop the infection again.
If left untreated, H. pylori can lead to gastritis, peptic ulcers, food intolerances, and stomach cancer. So it's definitely something that we want to treat.
So let's talk about the perspectives from traditional Chinese medicine. So in traditional Chinese medicine, H. pylori is associated with gastritis, and it's caused by emotional injury or an external evil, usually damp and heat, caused by improper diet. And there are a few ways that you can treat it with herbs, acupuncture, and diet.
So with herbs, usually we would use Chinese medicine herbs to clear heat, invigorate the spleen, and often used with probiotics to help in the recovery of H. pylori.
Definitely. So herbs that we would want to use would clear heat and detox, herbs that would clear heat and dry dampness, and herbs that would cool and transform phlegm. And we have some of those herbs listed here. So some herbs that would clear heat and detox include honeysuckle flower, Chinese wolfberry, and indigo. Some herbs that clear heat and dry dampness would include Copitus rhizome, Amarcork tree bark, and some that cool and transform phlegm heat would be gallnut cocoon of the Chinese sumac and schizandra fruit, for example.
Among many others.
I think the next is acupuncture treatment. Yes.
Oh, yes. So for acupuncture, usually a practitioner would choose around 2 to 3 points. The main points used for treating H. pylori would be bladder 20, bladder 21, Ren 12, stomach 36, and pericardium 6. And then depending on the symptoms, there are other points that we could use as well.
And a lot of those points do clear heat too.
Mm-hmm. And help the stomach.
Yeah, definitely. So as far as diet goes, it's really important to introduce probiotics, especially if you've been taking an antibiotic, so that you can improve your eradication rates. And a lot of times antibiotics get rid of the good flora and the good bacteria in your body as well as the bad. So you need to replenish it with good probiotics to kill, to replenish the ones that you killed. Green tea has also been proven to help and slow the growth of H. pylori, reduces inflammation, and you can also take it during the infection in cases of severe gastritis. Also, raw or manuka honey has really good antibacterial properties. And what are some other diet things you can do?
Olive oil is really good. Foods high in omega-3, berries. What else? We have herbal teas and drinking lots of fresh water, and I'm definitely avoiding foods that have pesticides on them because that's going to kill your good bacteria in your gut, and we really need that in order to fight the bad guys like H. pylori.
Absolutely. So making sure you have that well-washed food and well-prepared food. Definitely. And finally, these are our sources that we used. So thanks for watching our presentation.
Thank you.
And we'll see you guys later.
Happy 4th of July.